Liposuction. You've definitely heard the word, right? But do you know the incredible science that turned it from a pretty risky operation into, well, a refined art of body sculpting? This is the story of how science solved one tricky problem after another, transforming a dangerous procedure into something incredibly precise.
First, just to give you a little context here, liposuction is a huge deal. It's actually the second most popular cosmetic surgery in the United States right now. And that popularity, it's a direct result of the scientific breakthroughs we're about to get into.
And that really is the million-dollar question, isn't it? Because getting from point A, unwanted fat, to point B, a smoothly contoured result, involves tackling some pretty serious biological and physical challenges.
So the first and, the biggest hurdle in the early days of liposuction was massive blood loss. It was, without a doubt, the procedure's most dangerous problem. The solution that came along was nothing short of a revolution.
You know, the difference between liposuction back then and today is just staggering. We're talking about a move from a major operation needing general anesthesia and blood transfusions to a procedure done with local anesthesia where people are back to their daily lives almost right away. The game changer that made this possible, it was called the tumescent technique.
So, what is it exactly? Well, the tumescent technique is all about pumping the fat with a huge volume of a very diluted anesthetic solution. The key ingredients are lidocaine, which numbs everything, and, this is the crucial part, epinephrine. Epinephrine constricts the blood vessels, and that just dramatically cuts down on bleeding.
And here's the totally brilliant, kind of counterintuitive part. As the inventor, Dr. Jeffrey Klein, pointed out, watering down the anesthetic didn't make it weaker, it actually made it stronger. By spreading it out over a bigger area, it gave better numbness and an even more powerful constriction of the blood vessels. Just genius.
And the result? It was a night-and-day reduction in bleeding. With the old techniques, it was a huge, messy problem. With the tumescent technique, blood makes up only about 1% of the fluid that gets removed. This one innovation made the whole thing exponentially safer and really marked a shift from brute force to, finesse.
Okay, so with the bleeding problem basically solved, the next challenge really came into focus. How do you physically get the fat out in a way that creates a smooth result, and what do you do about the skin that's left behind?
The main tool of the trade is the cannula, which is just a thin tube. A surgeon makes these tiny little incisions and then uses these gentle, kind of piston-like movements to break up the fat deposits before they get suctioned out. It's a process that really requires a delicate touch and a solid, three-dimensional feel for the tissue. But here's the thing, right? When you remove all that volume from underneath the skin, you run the risk of leaving behind loose, saggy skin. And for a long time, this was a real problem that limited who was even a good candidate for the procedure. And that's where the next evolution came in, laser lipolysis. This technique brings laser energy right into the fat layer, and it does two things at once. First, it melts the fat, which makes it way easier to remove. And second, it heats the underside of the skin, which basically tells the body's healing response to kick in, create new collagen, and tighten up the skin.
Now, the really crucial point here is temperature. Research has shown that heating the tissue to a very specific range, right between 48 and 50 degrees Celsius, is the absolute sweet spot for what they call collagen denaturation. That's just a sciencey way of saying it signals the skin's support structure to rebuild itself stronger and tighter, but without, causing a...
So, as you can imagine, this led to a whole wave of new devices. Each one uses different laser wavelengths that are designed to specifically target fat, or the water in the collagen, or even the blood vessels. It really just goes to show you a field that's constantly tweaking and refining its tools to get better, more specific results.
All right, so we've solved for bleeding, and we've solved for loose skin. But especially for the really large volume procedures, there's this hidden scientific challenge that is absolutely critical to patient safety, managing the body's fluids during the surgery itself.
So here's the dilemma. The patient is losing fluid during the procedure, so you have to replace it with an IV. But if you give too little, you risk something called hypovolemia, which is a really dangerous drop in blood pressure. Give too much, and you can cause pulmonary edema, fluid actually backing up into the lungs. It is an incredibly high-wire act.
For years, anesthesiologists had to rely on a static formula, kind of like an educated guess, to figure out how much IV fluid to give. But now, we have technology like electrical cardiometry that lets them monitor the patient's cardiac output in real time and give fluids only when the body actually signals that it needs them. And a 2023 study showed exactly why this is so important. That green line you see? That represents patients managed with the old formula. Their urine output was consistently higher, which is a key sign that their bodies were working overtime to get rid of excess fluid they never needed in the first place.
I mean, the difference is just striking. The group that was monitored with real-time data got, on average, over a full liter less IV fluid during their surgery. That is a huge margin of safety that you gain just by moving from a static formula to dynamic, data-driven care.
So the takeaway here is just undeniable. By precisely measuring what the patient's body needs from one moment to the next, we can provide way safer, more accurate care. It's a perfect example of technology taking the guesswork right out of the operating room. So, with all the major safety challenges solved, the focus could finally turn to that last, crucial element, the artistic refinement. How do you get the smoothest, most natural-looking results you possibly can?
And this is where you really see that cascade of innovation in action. Because the tumescent technique had practically eliminated bleeding, it completely changed the surgeon's toolkit. They didn't have to use those big, crude cannulas anymore. Instead, they can now use these incredibly fine instruments called microcannulas.
And the benefits were just enormous. These tiny cannulas, some are just over 1 millimeter wide. They allow for incredible finesse. They cause less pain, they let the surgeon be more accurate and remove fat more completely, and because the incisions are so tiny, healing is way faster. It's all about getting a better result with a gentler technique.
And here's one last kind of counterintuitive step. Those tiny incisions made for the microcannulas, they're often just left open. This lets all that leftover tumescent fluid drain out, which dramatically cuts down on bruising and swelling after surgery, and that leads to a much faster, more comfortable recovery.
So, when you think about it, from a pharmacology solution for bleeding to the physics of lasers for skin tightening and the complex fluid dynamics of patient safety, liposuction has been on an absolutely incredible scientific journey. The question now is, with so much innovation already behind us, what scientific frontier is going to be conquered next to further refine the art of sculpting the human form?